this means we haven't gotten enough sleep, Carly.
Well, that is a great topic. Let's have more of a discussion about it.
Want to kick us off?
Yes. So welcome everyone who's able to be here with us today. Thank you so much. We are having a discussion today about sleep and how to get more of it in pregnancy and postpartum. The event is hosted by Starling, which is a digital membership that helps guide you through your entire pregnancy and the full year postpartum. You get paired with hand-picked groups as well as expert doulas to go with you through your entire journey. So as you can see here, our agenda, we're covering why it's difficult to sleep in pregnancy. We're talking about tips for success, including positions, diet, exercise, and other things that might be affecting your sleep. And then we also will go over some of the pharmacologic options or medications that you might want to discuss with your provider. So yeah, without further ado, I'm Carly. I'm a nurse midwife, and I'm the education lead here at Starling. And I'm here with Nazaneen Homaifar, who is an OBGYN doctor, and she's going to help kind of walk us through a little bit of her tips and advice. And she is also a mother of twins. So she's definitely been in it with us in the sleep struggle.
Really happy to be here today, Carly, and love being able to work with this team at Starling. I'm also the medical director here, and I practice out of Northern Virginia at Inova Healthcare Systems. So I think we were able to get some questions from people who saw our postings on Instagram, and we encourage the audience today to send in your questions, and we will be happy to go through them. But I guess one question I had for everyone is, has anyone had difficulty sleeping? And if so, what have your difficulties been? If you want to send those in the chat to us, we'll be able to take a look and kind of see where people are in this journey.
Yeah, I think it's great to say, like, what have they been? Because for everyone, it's really different, right? Like some people, it's more their physical body can't get comfortable or is moving. And for some people, it's their mind is running. So yes, please share sort of what's been going on with you so we can make sure we address your specific issues. And then Naz, let's see here. We have a couple questions coming in. First, kind of just to set the background so that everyone's on the same page. Can you talk a little bit about the physiologic changes that are happening in pregnancy that are kind of making this sleep difficult?
Absolutely. And I think it's really important to know that this problem is really prevalent in pregnancy. 1/4 of people in the first trimester to over 2/3 by the end of the third trimester will have difficulty sleeping. And I think it's important to understand that there's different reasons why it's going to happen throughout the pregnancy. So in the first trimester, we know that there are increased pregnancy hormones, and the progesterone, which is one of those dominant hormones, is really what helps support the pregnancy, but it also is the hormone that causes the mood swings, the breast tenderness. It slows down your gastrointestinal tract, so it increases reflux and increases constipation, and it also makes you feel so exhausted. And the hormones also act on your kidneys, and they increase urination, and especially urination at night. And I remember going through residency, this was humbling for me. Like when I went through residency and did 24-hour calls and hadn't slept all night, and then I would have a pregnant patient be like, I feel so exhausted. I'd kind of I'd nod and I'd say, yeah, I can imagine, I haven't slept for 24 hours. I know what that feels like. But then when I got pregnant and I felt that exhaustion, I was like, holy crap, this is worse than anything I ever experienced as a resident, because it felt like no matter how much I slept, I still woke up feeling like a bus hit me and I could sleep for a few more days. I don't know, Carly, did you ever feel It was a lot more intense than I.
Yeah, I agree. I mean, I think what it is sort of that like overall body exhaustion, which is like it's almost like it was like a weight sort of feeling. Like
Right.
I would wake up and like, yeah, my head was like foggy tired, but I was like, oh my gosh, I could just collapse. I'm so tired.
Totally.
Um,
I
and
oh,
I was
sorry.
just saying the quality of my sleep. Somebody mentioned in the chat here about waking up 5 times a night. And I think that is something I hear so frequently from my patients in prenatal care and postpartum. Obviously, people are waking up, but you're so tired and yet you're still waking up. For some reason, your body's still waking you up.
Right. And I think, and so that leads me to the second trimester and third trimester and reasons why you might have difficulty sleeping. So in the second trimester, you can start feeling restless leg syndrome. So you feel like you have to move your legs a lot at night in order to get comfortable. The uterus starts to grow, and as it starts to grow, it pushes up on your intestines, and your muscles and ligaments start to relax a little bit. So you have increased back pain. And that can make it difficult to just move around and to get comfortable. Heartburn but can become worse in the second and third trimester, and that can keep people up. Um, in the third trimester, you might start developing Braxton Hicks, which is like false labor or contractions that don't have, sorry, don't have consistency to them. So Braxton Hicks can keep you up, or you can develop, if you didn't have sciatica before, if you did, it can be worsened and you start getting like sharp shooting pains in your back, down your leg. And then, as much as we love fetal movement, as much as we, as prenatal healthcare providers, use it as a metric for, the fetus and the baby being okay, sometimes it can be a lot, and it can be really uncomfortable. So all that kicking and punching,
Like jab to the ribs, right? You're
yeah,
like, oh, I was just getting comfortable and now you've given me a big kick.
exactly. I got a phone call from a patient like 2 weeks ago being like, how much movement is too much, because I couldn't sleep all night. And I was like, I'm really sorry. There's no, that movement is okay, but I can completely understand how disruptive it can be.
Yeah.
Um,
And a couple people mentioned here the cramps, right? I would jump out of bed with that Charlie horse in my thigh, in my calf, for
yeah,
example. And
yeah,
I thought I was doing the right things, but I mean, it comes out of nowhere.
right. And you could have been the best sleeper before pregnancy, and then all of a sudden, like the boat is rocked because there are all these different things that are affecting your sleep, and the quality of the sleep you can get.
Yeah. And it sounds like, as a couple people here have also, brought up waking up multiple times, waking up to pee, waking up 5 different times in the night. So, is all of this, you think, some of these like hormonal things that are happening, these changes? Is there something else?
I mean, it's important to think about, we know that there are physiologic changes in pregnancy that are certainly going to make sleep more challenging. And we discussed some of those just now, just the physiologic changes. But it's important to also take a step back and understand what else could be causing sleep issues. So um, you can have the physical changes that we talked about. You could have other underlying conditions that can affect your ability to sleep. And then it's always important to acknowledge the psychological and emotional aspect uh, of pregnancy that can be affecting your sleep. So when it comes to the physiologic changes, we kind of discussed all of those. Underlying medical conditions, you have to, maybe someone has undiagnosed sleep apnea, or they're taking medications that can affect their sleep. And in terms of psychological or mental conditions, there could be degrees of mood disorders or anxiety and depression that could affect sleep, or just that general like nesting phase that people go through in pregnancy, where you're kind of thinking about the million things you have to do and not feeling like you have enough time.
Yeah. I think that idea of the nesting and like, where does nesting kind of turn into this more intrusive anxiety, right? Because it is a drive. It's you know, it's hormonal, it's your body like starting to prepare for this baby, but that waking up with the racing thoughts or can't fall asleep because you just are going over all the things that you need to do that you should have done. One of the things that I often will tell patients to do is to keep a journal next to their bed, because sometimes getting it out of your mind will help you fall asleep a little bit better. Put your to-do list, say all the things that you hope to get done tomorrow, and then, acknowledging also, even in writing, the things that you are doing well, because there's just so much that can go into your thoughts on like what I should have done today, or guilty about something I ate or something like that. And just like put it
Yeah.
away, put it away before bed.
I love that. And I started doing that. I started doing that postpartum. I wish I had had that tip while I was pregnant, but postpartum, I found, especially when I went back to work, I was overwhelmed. Like falling to sleep for me was the time when my mind could actually be quiet for a second for me to then be reminded of all the stuff that I needed to do. And so then it would trigger this running list of things I had to do. And I would look over and my partner was snoring within 5 minutes. And I just like
Yeah.
wanted to do something to wake him up because I was so annoyed. But here I was like an hour and a half later, like trying to process everything. So having that journal really helped me have a mental dump where I could put everything and know that, okay, when I wake up in the morning, I will be able to handle some of these things. So I think that that's helpful. And it kind of reminded me, one thing that I think we want people to understand is checking in as to why you're having difficulty sleeping. Is it because you can't fall asleep at night or you can't get comfortable? Is it that you're falling asleep and then, or sorry, you're falling asleep okay and getting up to go to the bathroom and afterwards you're having difficulty sleeping? Or is it that you're waking up early every night or every morning, I should say? So you kind of individually have to figure out um, what is your scenario, what is going on.
Yeah, before you can really address it. Something that has come up in the chat that I really want to address, because I think it's important and it comes up a lot, is I mentioned that with the nesting, you have this drive to get a bunch of stuff ready, get a bunch of stuff done. We are like newly invested in our health as we're growing another person in there. But how would you, if patients are saying, I can't tell if I'm having like true anxiety versus just kind of like normal nesting, what would be sort of your guide to help them decipher that?
Well, it's kind of, so we know that there's a definitive way to diagnose postpartum anxiety and not just postpartum, perinatal anxiety. And that can include having certain symptoms like panic attacks or intrusive thoughts or excessive worry, restless sleep. And that is, I would say, if you are worried and you don't know, you should definitely speak to your perinatal healthcare provider. So whether that's an OB-GYN or a midwife or a nurse practitioner, this is something to bring up because we have validated questionnaires and surveys that help us determine if you have anxiety in your pregnancy or postpartum. And it's not so easy to say, like for me to give an answer as to this is anxiety versus this is nesting, but there are validated surveys. So you might have heard of the GAD-7 or General Anxiety Disorders Survey. There's something called the Edinburgh, I think, Postpartum Depression Survey. I'm not always good with acronyms, but it's EPDS or the PHQ-9. And these are all validated surveys that are designed to help screen for perinatal mental health and anxiety disorders. So if you're worried, you need to have a conversation with your medical provider.
Yeah, I agree. I think there's some part of us, especially we have our phones so accessible and, people are Googling symptoms all the time. And I would also encourage you to like Google the things that are going to make it better. And then if you try those things and it's not better, then that's probably a clue you should talk to somebody, right? So if this is a perfect example. You're coming to this event, you're here, we're talking about it. We're going to talk about some of the tips physically as well. We're kind of talking about some of those bracing thought tips. But if you're trying all these tips and they aren't working for you, then that's a really good signal that, have a conversation about your personal symptoms with your provider.
Absolutely. And I liked, Carly, you were talking about the journal, having that journal to kind of dump your thoughts in. What other tips do you have for like routines or habits people can adopt to help them with their sleep in pregnancy?
So I think this is actually something that kind of what you mentioned is this was a tip you learned postpartum. So for me, I also have a daughter who's 16 months old. And I feel like when I was learning to train and help her sleep, I learned a lot about how the brain makes these sleep associations. So for a baby, they tell you to like do sort of the same routine leading up to bed. And it, of course, works for adults as well. So thinking about how to wind down, how to not be, maybe looking at your phone or a blue light before bed just to get that extra stimulation down. But what are kind of the things that help you individually unwind from your days? For some people, that'll be a really good stretch, which I always encourage pregnant and postpartum people because your body is taking on so much. A lot of times, a warm shower, a cup of, chamomile, non-caffeinated tea of some sort. But trying to get into something that really just unwinds you. And for some people, that might be, just a 2 to 3 minute wind down. I have a colleague who has about an hour long wind down routine. And I think it just really depends on yourself, but noticing just kind of what works. And trying to stay consistent with that, keeping the lights low, kind of really telling your brain, okay, it's sleep time now.
And I think, and to be honest, I tell my patients this all the time. And then I also tell them I'm horrible at practicing it myself, but trying to put your phone away or trying to stay away from blue screen lights, trying to just create a space where you can really start um, unplugging so that you can, as you mentioned, create a technique for yourself where your body knows I'm going to sleep. So um, I know some people put their phone in another room, or mine is like right by my pillow, which is definitely not good for sleep hygiene. But one should put it further away, maybe, or just avoid checking emails or anything that's going to provoke some anxiety. I really value time alone in the bathroom. And this might be TMI, but like I go to the bathroom and I sit and I have my time to myself to just like brush my teeth. My nighttime routine is not that long, but I just needed that time to where no one can interrupt me. So that was part of my routine. But I've also like I tried I think Calm and Headspace have the bedtime stories for adults, and I found that really helpful in the early third trimester when I was having trouble sleeping. Um, Nothing
Yeah,
like.
I think that idea, the bedtime stories, they also have some like falling asleep meditations.
Mhm.
I Something that I also love is after you're about 20 weeks gestation and your baby can hear, sometimes it's nice to talk or sing to your baby or just sort of put your hands on your belly and do those deep breathing. And so even if you're not
Yeah.
talking out loud, sort of sending, a repetitive affirmation to your baby, like, we're okay, we're building, telling them about your day, just to really like connect to your pregnancy, put your hands on your belly, but just kind of really focus and wind down in that way.
I love that. And there actually are studies, and I don't remember the specifics, where babies who had heard a certain song in utero associated that and were able to soothe more quickly when they heard that later. And I think they had used like some kind of bedtime story, but we played, I don't know if you did this at all, Carly, but like we played the Mamas and the Papas for our girls. Like it was one of the songs we danced to at our wedding, and we played that every night. We try to play it every night for them. And now that they're almost 4, sometimes we'll play it and like slow dance in the kitchen all together. But I think that was a way for my partner and I to also just create some space for ourselves, at bedtime when I wasn't doom scrolling on my phone.
I love that. I think it's so sweet that that was a wedding song for you guys. We used to play and sing Can't Help Falling in Love, Elvis Presley, and then
Mhm.
a Jose Luis Perales song that's called See. And it's just, it's like a love song that's like very sweet and applicable to a little babe. So those are still actually the songs that we sing as our daughter goes to bed. So they definitely have been a crutch, I would say, that we've leaned on to help with sleep.
Absolutely. I mean, that's, and I'm gonna look up the last song later because I
Oh
might
yeah, I'll send it to you.
add
It's
to
really sweet.
my repertoire. I think so. I think the things that you've mentioned, Carly, are so helpful in the ones that we discussed. So if you've worked on your sleep hygiene and things aren't working and you realize it's become a hindrance in your life, then that's when I would definitely make sure you bring it up with your healthcare provider. Because if you have multiple nights in a row when you haven't slept, it's going to be stressful. You're going to wake up exhausted. It's going to put you on edge a little bit more. It can affect your blood pressure levels. So, and your ability, if you are working, to stay focused at work. So that would be a time to talk about, bring it up with your provider and see what else can be done.
Yeah, I'd love to also bounce this out to our participants. What do you guys do sort of in your sleep routines? What are your sort of wind down or like getting ready for bed type things? And then meanwhile, Naz, something that somebody asked that I'd love to kind of get your opinions on is, so there are a ton of different herbal teas. And I mentioned chamomile because it's one that I know that is safe, for like a mint tea.
Mhm.
What about, other herbal type infusion teas that people are taking? How do they look up if it's something that they should be taking or shouldn't be taking?
Yeah, I think so. I am not an herbalist. And I think for the most part, a lot of the teas that you go to the supermarket that are like the yogi teas that are geared towards sleep are going to be fine. We never want you to take anything in excess. Like that's when we know it might be potentially problematic. But I really love mothertobaby.org. And it's to like TO, not to the number. And if you look up under fact sheets, they have an incredible library of medications, some herbal supplements, not so many, where you can look to see the safety of a product to use in pregnancy or postpartum if you're breastfeeding. I will say, I mean, it's really hard because not a lot of studies are done on pregnant people. So we don't have great data, but for the most part, most herbal teas will be fine. Magnesium is also really helpful. So I think Calm makes like a powder that you can mix in with water. And I have found that for people who have restless leg or even just difficulty sleeping, that can be useful.
Yeah, and I have definitely had some patients who don't love the taste of Calm, and so I will sometimes prescribe magnesium pills that they can take at night as well. So if you try to take a sip of it and it's making you nauseous, or like something about that like lemony raspberry situation isn't working for you, definitely talk to your midwife or your OBGYN about that as well.
Absolutely.
And then a couple other people said exercise. I see reading, counting back from 100. You know, everybody is so different. I will say for some people, a little bit of exercise makes them really tired. They take their shower and they fall asleep. Other people, that can be really activating, right? And so same thing with reading. If you're reading and it puts you into that, very drowsy state, that's great. Another thing that people often will talk about is sex. Some people will have sex and then they're exhausted and they are kind of like in a good, warm, drowsy mood. And other people, it's like, okay, cool. Like, what are we going to do next? So really paying attention to, is this part of my routine activating me, or is this helping me wind down?
Yeah, and I think we know that the exercise can certainly help. So if it is activating, doing it earlier on in the day, or thinking about these activities that are activating, if you're consuming caffeine, making sure you finish at 4 p.m. or something like, at
I
least.
can't drink caffeine past noon or I'm up all night. I have to like hit it early, and then really after lunch, it's like I cannot have an after lunch coffee.
Yeah, different issues for me, but it's so important to know about yourself. And I love that someone said a warm shower. Absolutely. Like a bath or warm shower can very much be relaxing before bedtime.
Okay. So what is the next question? So if somebody is going to tell you about their bedtime routine, what's the next sort of step that you'd want to know after that? Um,
Kind of, I mentioned this a little bit earlier, but just a reminder of like getting a sense of, so then when you do your bedtime routine, are you falling asleep okay? And what is it that you're feeling? Are you waking up not feeling well rested, even though you slept through the night? Are you waking up in the middle of the night and going to the bathroom? And then you find that very activating and you can't fall asleep. Do you feel like you're getting deep sleep? Or are there things on your mind that are making it difficult to go to sleep? I think if people are saying they can't go to bed after they've gotten up to go to the bathroom, we would say like limit your amount of fluid intake right before bed, go to the bathroom. When you do get up in the middle of the night, maybe try having a night light in the bathroom instead of having to turn on the light completely, because the bright light can make it difficult to go back to sleep. Anything else that you ask patient? I always say patients or people.
Yeah, I think what's something that comes up a lot is that people will mention either some physical symptom, right? They can't get comfortable, they're tossing and turning, you mentioned restless leg, we talked about the cramps. People will often talk about sort of really vivid dreams, sometimes like panic dreams or nightmare dreams, or kind of do you have, I think for me the question is what's waking you up? And then when we hear what that is, like what are some of the solutions that we know?
Yeah, I think so. If we talked about different routines that you can try, and then obviously talk to your provider to see if there are any underlying things. Restless leg could be caused by anemia in pregnancy, and it can be rectified with taking iron supplements or trying magnesium. If it is increased urination, we know that that's common, but making sure maybe you don't have a UTI that's making it more difficult. If there's anxiety or underlying depression, figuring out what would be the best treatment. And there are many medications that are safe to take in pregnancy if you do need help going to sleep. So some of those would be something like Unisom. And Unisom is a medication that you might take early on in pregnancy with vitamin B6 to help with nausea and vomiting. But it can also be used on its own to help. It kind of makes you really drowsy. So if you have difficulty going to sleep, it might be something that you try. Believe it or not, Ambien is safe to take in pregnancy, but I would talk to your medical provider. We're not here to give medical advice, but talk to your provider to see if that would be something that would, down the road would be something, or even Benadryl can be used to help with sleep, or melatonin as well.
Great. Yeah, I think that's the key, is that because it's so personal, even though this is almost a universal experience of pregnant people, it's still personal what it is that's keeping you up, right? And I think, if you are doing these things, like you're exercising during the day, you're cutting your caffeine out, you're getting into a good wind down routine, and you're still feeling like something is really preventing you from sleeping, um, talk to your provider and see, with the physical stuff, I would say you mentioned in the beginning some of the GERD or like the acid reflux, where you feel like you have this like metally, like acidy kind of feeling in your chest. And sometimes it can actually be like almost like a painful feeling. One of the things that we suggest is having a lot of extra pillows. So I think pregnant people need like 4 pillows, because you sometimes need 2 behind your back so that you're not lying perfectly, flat down where that acid is more likely to come up. And then you need like, under your knees, between your knees, sort of supporting like under your back a bit. So
Yeah.
experimenting with different positions and pillows.
Absolutely. And to the pillows point, yes. And data even supports it. Even putting pillows or some people say raise your bed, which I don't really understand. Like, I don't think that's actually feasible, so that the bed is actually at a 45-degree angle, but having those pillows to lift you up. And then, treating that reflex, there's things that you can use over the counter to treat it, but using the pillows to elevate the head and then putting a pillow in between your legs at night actually helps correct the spine, make the spine and the hips and legs at the same level so it doesn't exacerbate back pain. So if you're having back pain, that's a really good thing to try. I still actually use a pillow. I got I had two different pillows in when I was pregnant. I had the one that you put between your legs, and then I had the U-shaped pillow so that I can
That's
prop
like
my
the giant, like, body kind of rounded situation. Yeah.
Yeah, and I liked that instead of the C-shaped pillow because no matter which way I turned, I didn't have to bring the pillow with me. So I could just turn and I would put one hand under the pillow and then my other hand over it and my leg. I love like propping up my leg to keep I just get pain when I don't like prop it up. So um I would prop up my leg on that and my partner was spared the weight of my
Legs flopping. So,
yeah.
I think also you're sort of touching on this idea, like your joints and your ligaments become much more lax in pregnancy as part of the hormonal shift that happens. And so, even if you didn't necessarily have hip pain that's coming from the baby actually pushing on your bones or anything like that, so even very early in pregnancy, people will start to have more like knee, hip, sort of lower back pain. And so I think these pillow techniques and tips for finding comfort are really helpful all the way through your pregnancy and kind of what you're mentioning, even postpartum. I think I'd love to talk a little bit more about for some of the people whose questions are coming in postpartum, but that
Mhm.
joint laxity is something that continues for a while and really so trying to find supportive ways that your body can rest is important.
Absolutely. Yeah, let's talk about postpartum because it's going to look very different from
Yeah, what is even normal sleep postpartum, right?
I mean, it's probably stretches of 2 to 3 hours during the first few weeks, especially if you're motivated to breastfeed or you're pumping. Baby needs to get up every 2 to 3 hours, and you really need to work on building up your supply. So that's why we encourage people to feed and or pump every 2 to 3 hours. Um,
But if
and
baby's sleeping and getting up every 3 hours and I'm washing my pump parts or making a bottle or, picking them up, changing them, like 3 hours sort of seems like a luxury.
Right. And it doesn't even feel like sometimes it's not 3 hours because by the time you finish the routine, you have an hour and a half to 2 hours left.
Well, by
Uh,
the time you finish the routine and watch them breathe, right? Because like I did a lot of like wondering, like, is everything okay? Right. So that's something also that people continue to bring up is how to calm that anxiety postpartum when you're like exhausted and you only have 2 hours and now you're like thinking about your baby.
I know. I remember one night when I was like particularly sleepless, being like, we don't even allow people to operate heavy machinery or like drive a plane if they haven't slept in 8 hours. Like, why? How do I have the responsibility of keeping like little humans alive on such little sleep? Like, it can be a lot, which is why it's so important to tap into your support network. And also, if you have a partner at home, figuring out how they're going to be involved in creating a space for each of you to get some chunk of sleep so you can be functional. And if you have loved ones who are going to come help you in the postpartum period, or if you are hiring a nighttime doula, really being intentional about how you're utilizing that help. Like early on, I was really lucky. We were living in California when my girls were born, and my entire family came to visit. And my dad has insomnia. So he wakes up usually at 5 a.m. And when he was on the West Coast, that was 3 a.m. or 2 a.m. So he would do the middle of the night feeds with me, where he would bottle feed one of the girls while I was breastfeeding them. And then he would burp them and I would take the other one. So we had a routine so that in the middle of the night, I was never alone.
Don't do
Um,
it all.
And so I think it's important to like figure out ahead of time what resources you might have to help you during this time too, to help maximize whether if it's not at night during the day, how can you get a nap? Can someone take the baby so you can go somewhere quiet and sleep?
I think I like the idea of having a plan, right? So luckily, you'll have plenty of opportunities to like change that plan if it's not working. But
Yeah.
if you're breastfeeding, working on like a sideline feed where somebody else can bring the baby to you in bed and you stay sort of drowsy, half asleep while they make sure the baby's safe next to you. And if you're bottle feeding, if there's somebody else that can say, okay, I'll take the feed that happens before 2 a.m. and then, you go try to go to bed as soon as baby goes to bed and then wake up for the next feed. So really thinking about it ahead of time and trying to make a plan, knowing of course that all of these plans will change. But
Absolutely.
just to see if you can even get one night where you sneak in those 4 or 5 hours, it can help you be a much better planner the next day.
Absolutely. And I think you said something that's so key. You have to be flexible, because something that worked one week may not work the next week because baby's going through rapid periods of growth and its needs are changing. And so are the things that you need. The first 2 weeks might feel brutal with 2 to 3 hours of sleep. And by week three, that might be okay. Like you might be fine getting a 3 hour chunk, but then having a 4 hour, like you might experience your first 4 hour chunk of sleep. And it's amazing how refreshing that can feel. After,
I think also, especially in those first weeks, even the first full month, is like it's so ingrained in us to try to get so many things done. Like you are trying to think about getting your own food, you're trying to do the laundry, you have all these diapers, you have all this stuff to do. And maybe having a thought partner, whether that's your, a co-parent, whether that's like, for you, your dad, or somebody else who can help say, wait, is washing this dish necessary right now? Or like, is there another person that could help with something outside of the feeding that would like make the sleeping happen more or longer or be more relaxing? Maybe for me, as somebody who was always worried about like, what are they doing out there with my baby? If they take the baby for a walk, then I'm actually going to probably sleep more than if they're playing with the baby in the other room and I can kind of hear like the cooing, maybe crying situation.
I think that's great. And yeah, it takes some time. And this is where I think if you do have a partner at home, like this is on both of you to figure out and to help support each other because um, it is, it's an intense time. And you might have a neighbor that says, like, what can I do to help? Or any visitor who wants to come and you feel safe having them over. Like they don't come to sit there and watch and hold the baby. They should be coming with some intention of like, are they going to help unload the dishwasher? Or maybe you can sit and fold clothes together, or they're bringing a meal, like, or they're holding baby and you're getting your first shower at 6 p.m. at night. Like,
Yeah.
think about
Yeah,
your,
absolutely. I think that is like such an important tip. And there's actually been a couple questions coming in that I want to share with you about like how having that partner and like how to have them help. One of them, who is another person who's also having twins, asked
yeah,
kind of some logistical tips about how to involve a partner to be able to support sleep, because you're worried about yourself, but you're also worried about your partner and making sure there's like some balance and also that they're not exhausted as well. So
sure.
maybe we can start with that one.
Yeah, I think so. I'm going to go on my soapbox and just say that, like, I think if you have parental leave, everyone should maximize the amount of time that they take off, because you're both. If you are a couple that are going through this, you're both parents and involved. And if you both get time off, please maximize and take it so that you can be supportive during this time. We so we had a system. I was supplementing with formula early on because I just didn't have enough supply for twins. So that kind of made things a little easy because I didn't need to be awake when we were giving formula, and we had something that helped make the formula much quicker than having to like stir it, and it also meant that anyone could give the girls a bottle, or I could pump if I knew that they were going to get formula for one feed. I would wake up, pump really quickly, wash everything, go back to sleep, and then I'd leave the bottle out so that my husband would wake up, and he would give the bottle that I had pumped.
Gotcha.
So it's coming up with a schedule and understanding that, once my partner went back to work, what we did was that during the week, Sunday through Thursday, I was the one that would wake up twice and feed the girls, but then Friday and Saturday I had off. So I would go to another room and sleep, and he would be the one. So that it didn't feel like Groundhog's Day, and that like I could never get any sleep. And at that point, maybe I would just pump once a night rather than waking up twice, or I'd pump right before I went to sleep and wake up early in the morning and pump. So I think it's about figuring out what's working, and I can send more tips to that person.
Yeah, for sure. I was going to say in our 7 Starling groups, this comes up all the time because even, you have twins and you're like, how is this going to be possible? But even for people with one baby, the navigating that partner role, and getting the baby to sleep, right? Just even any sort of sleep routine or getting the baby to sleep. And one of the things that I have had people in the past talk about is really planning even before you have your baby, like an idea of a sleep routine, kind of what we talked about, these associations of, feed, maybe read a book, change, bed, or whatever, like that series of things are, and really sticking to it. With 2, you almost are forced to stick to it more, right? Because it's like, you're not going to necessarily let the baby fall asleep nursing if there's a little hungry sibling sitting right there. So that tip for twins can actually be used for anybody, of like establishing this routine and sticking to it, because the more the baby gets used to that, likely they're going to be able to kind of settle into being like, okay, now I sleep, right?
Yeah.
If they know every time I feed, then there's like some book or some, song, or, I get put into my little sleep swaddle. And then I am, placed safely on my back and fall asleep. They almost like adjust quicker,
Yeah.
knowing that's so consistently happening.
I really like that. And I think it's important to remember that it's a sleep, like it's a routine, but at this early on postpartum, you can't expect, like, there's no such thing as sleep training so early on.
No,
It's
no. Yeah.
helping them like come up with a routine, and hopefully adjusting to it. And I know someone had said like they get really nauseous when they have less than 6 hours of sleep. And I get that. And you could try vitamin B6. Um, I I think there are some things that you can take to help with nausea, but you understand the root of it is lack of sleep. And I think in that case, if you're worried, that might be a good reason to think about using outside help. And I know it can be expensive, but maybe that's where like there is a role for a nighttime doula twice a week or something, so that you know that you're getting guaranteed sleep on those nights.
Yeah, and that's, it's great to mention. Of course, it would be lovely if you happen to have a set of family in town that doesn't completely drive you bonkers and are willing to help. But sometimes you need to think kind of outside the box. And so whether that's, somebody that's hired, or if if that's like really outside of your means, talking to one of the social workers at the hospital about like what might be available in terms of resources, it's worth looking into, because your sleep can directly affect both your physical and your mental health. And if you're feeling like you cannot get on top of it, making sure to reach out is an important step to take.
Absolutely. And I know, Carly, we are running out of time. But
There
should
was
we talk
one
about
question that I did want to, or one comment that somebody made here, about people scare you about skipping a feeding or pumping, so that you can sleep. And I think it's so important to say that, because if your baby is gaining weight, if your baby is old enough, if your milk supply is established, and you stretch out that 3 hours to 4 hours one time or 2 times, or it's becoming your habit, and and the baby's getting calories during the day, then that can totally be a coping mechanism that's worth doing. The important thing is that you're checking with your pediatrician if it's a safe time yet for you to start doing that, because in the very first, few weeks and days, everybody's course is going to be really different, but it's common for babies to lose weight. So absolutely prioritizing your sleep once baby is safely gaining weight and getting the calories they need during the day is a fantastic piece of advice, whoever mentioned that in the chat.
Absolutely. Should we talk about some of our takeaways, Carly?
Yes. So yeah, what would you say if, these people are dying to get sleep? They're going to go, they're going to tell their family, their friends that are pregnant, they're going to, tell their group, if they couldn't make, the rest of their group couldn't make it today. What are the, first of all, what is sleep normal? Pregnancy and postpartum. We said normal.
Normal in pregnancy, we know that it's very common, like 3 out of 4 people in the second and third trimester might have difficulty with sleep. And postpartum, we know that, stretches of 2 to 3 hours in the first few weeks and maybe 4 to 5 hours or 6 hours, after the 10 to 12 week mark is in the realm of normal.
Okay. And then I would say, in terms of our takeaways of how people can improve their sleep. So in pregnancy, and also postpartum, although postpartum, sometimes it's more obvious where it's coming from. Pregnancy is really doing that self-evaluation. What is your sleep disturbance being caused from? Is it physical? Is it your brain is running? Is it, getting up to pee? Is it something that you can shift the routine slightly and affect, or is it something that you need to consult a little bit further for with your prenatal care provider?
Right. And knowing that a lot of times in pregnancy, you have increased waking after falling asleep, more light sleep and less deep sleep. And that with the physiological changes, underlying medical conditions, and side effects of medication, those could be causes as well.
And that there are, I think, knowing that there is help, right? Knowing that there are experts, there are people who can help. There are definitely experts on baby sleep, that if that's the reason you're not sleeping. If it's, in pregnancy, your midwife, your OBGYN, often a therapist can help with sleep routine, and if medication is needed with that as well. So
absolutely.
And people will get a good restful night.
Yeah. And knowing that, like, if people actually do have insomnia, cognitive behavioral therapy is actually the preferred form of treatment. And there's so many benefits of CBT for people trying to get sleep, or even just having overall good mental health. And it's something that we like to focus on in 7 Starling. So tapping into that can help establishing those routines, as you mentioned. And then one that we didn't really actually verbalize, but using your bed for sleep and sex, not using it for work and all the Zoom meetings, just making sure it's a place that you associate. We're creating all these associations for babies that you associate with sleep as well.
Yeah, absolutely. Naz, thank you so much. I have to say, everyone, I've learned from this conversation too, more tips and tricks. For those of you who do want to talk more with either an expert doula or with other people going through pregnancy at the same stage as you, we definitely address perinatal sleep difficulties in our groups. From our event today, we actually have a code to sign up for 7 Starling. It's SS Events, and you can get 15% off of your membership. Or head over to 7starling.com to get a little more information about what we offer and how to get matched with your expert doula and your group. Thank you so much for being here, Naz. It's been fantastic. This is a really important topic to almost everyone. So thank you.
Always a pleasure, Carly.
And everyone else, look out for an email with some updates and tips.
Bye. Thanks for joining us.